So the outpatient dialysis market is very bustling, and it's quite vibrant in terms of patient movement. So these are patients that are typically receiving hemodialysis 3 times a week. And so they're being, either going in as an outpatient or they may be being brought in via ambulance or minivan from long-term care facilities. And so, regardless of where they're coming from, the infection control standards as defined by CDC and CMS really exist to protect the patients that are coming there in these more congregate settings, right? Dialysis settings are quite packed. There's not a lot of separation between patients. There's a lot of equipment used, and there's certainly a very high risk for bloodborne pathogen contamination. So we need to make sure that we're prepared. Obviously, dialysis patients have to receive dialysis. It's of critical importance, or they will not survive. And so there is a requirement to be prepared to receive patients on isolation precautions. And so, many of these facilities will have sort of an isolation room. And so this would be another tool that could be added to that so that you have continuous air disinfection that could be placed into that room. And I would also recommend, frankly, that you put, a unit like this in the main room, right? Because you've got, sometimes 20, 30, 40, 50 patients that are in this very crowded room that are at one single time, in some instances, in large dialysis centers that are certainly going to be at increased risk for respiratory disease, right? This is particularly problematic for us in the fall and winter months when we have our increases and spikes in respiratory diseases like RSV, flus, your pneumonias, and things like that. And so it's really important that we think a little bit more outside of the box and go above the minimal requirements of the isolation room itself, but also think about the general dialysis delivery area in that full clinical area.